In this video, we're diving into a crucial topic, use of carbohydrates in diabetes. How different types of carbohydrates affect your blood sugar and why understanding them is essential for your health. Stay with us as we uncover the secrets of carbohydrates and make better choices for a healthier life. What are the different types of carbohydrates? Carbohydrates are divided into three main categories. 1. Starches. Starch is a type of complex carbohydrate found in foods such as bread, rice, potatoes, and legumes. It gradually converts into sugar or glucose in the body. 2. Fiber. Fiber is a part of plants that is not digested in the body, but it helps control blood sugar, reduce appetite, and support digestive health. 3. Sugars. Carbohydrates have a specific effect on your blood sugar levels. So, let's take a closer look and see how each type can actually support and improve your overall health. Sugars. These nutrients, after being consumed, are broken down in the digestive system and enter the bloodstream as glucose. The glucose is then absorbed by the body cells and used as fuel to produce energy. Types of sugars: natural sugars, added sugars. Natural sugars, like those found in fruits, vegetables, dairy, whole grains, and legumes, come along with beneficial nutrients such as fiber, vitamins, and minerals. Main sources of natural sugars. Fruits contain fructose and glucose, which along with fiber and antioxidants slow down the absorption of sugar. Dairy products. Milk and yogurt contain lactose, which is naturally present in these products. Vegetables. Some vegetables like carrots and beets contain small amounts of natural sugars. Whole grains and legumes contain complex carbohydrates that are converted into glucose and provide sustained energy. Sugars found in dairy products. Most people, when they hear the word dairy, think of calcium and protein, but dairy products also contain natural sugar. This sugar is known as lactose. After digestion, lactose is broken down into glucose and galactose, which are used as a source of energy for the body's cells. Added sugars. Added sugars are sweeteners that are added to foods and beverages during processing or preparation. These sugars are not naturally present in the food and are usually used to enhance flavor, texture, or shelf life of the products. Examples include adding sugar to coffee, breakfast, cereals, jam, soft drink, and sweets. Natural added sugars. These are sweeteners that are extracted from natural sources but are added separately during the food preparation process. Examples: white sugar, brown sugar, honey, grape syrup, high fructose corn syrup, maple syrup. Although they are natural, when added to food, they are still considered added sugars. Artificial added sugars. These are man-made sweeteners that are usually much sweeter than sugar and contain very few or no calories. Common examples: aspartame, saccharin, sucralose, brand name Splenda. Stevia. Although it is plant-based, it is processed and added to foods. These sugars are commonly used in diet sodas, chewing gum, sugar-free products, and diet foods. Important note: excessive consumption of added sugars, whether natural or artificial, may lead to problems in the long term, such as weight gain, insulin resistance, or disruption in appetite regulation. It is better to limit the consumption of these substances except in special situations, such as low blood sugar, hypoglycemia, because consuming a small amount of simple sugars like fruit juice or sugar can rapidly raise blood sugar levels. Disadvantages of regular consumption of added sugars for diabetic patients. Sudden increase in blood sugar or glucose, which makes diabetes control more difficult. Weight gain, which leads to insulin resistance and worsens diabetes. Increased risk of heart disease and high cholesterol levels. Early feelings of hunger as added sugars are rapidly absorbed, causing a sudden rise in blood sugar, followed by a rapid drop, which triggers appetite again. Drinking just one 200 milliliter bottle of soft drink can introduce about 20 to 25 grams of added sugar into the body. This amount rapidly raises blood sugar levels and triggers the body's insulin response, which can ultimately lead to a sharp drop in blood sugar and cause early feelings of hunger. Benefits of limiting added sugar intake: improved blood sugar control, reduced need for medication, weight loss, increased energy levels. If you found this video helpful, please support us by liking and sharing it. Subscribe to our channel and turn on the notification bell to stay updated with the latest health education content.